Well, Dr. Malmed has spent 27 years as a chiropractor and certified applied kinesiologist in the state of New York. He's also an orthotic trainer and teaches other doctors about orthotics. And for the last year, Dr. Malmed has been working in a hospital, and I know that's been a very interesting environment for you to work with. Another thing about Dr. Malmed, he is one of those healthcare professionals that is absolutely leading the charge in helping other professionals understand and grasp the sheer magnitude of the ASEA breakthrough.
Okay, thank you so much, Alan. I really appreciate it. I graduated Syracuse University in 1979 with a major in anthropology and psychology minor in sciences. I was originally going to be a dentist, and I was pre-dental at Syracuse, and I didn't really like this. I ended up becoming a chiropractor and went to Palmer College of Chiropractic and graduated there from Davenport, Iowa in 1983. While I was out there, I had some significant conditions that lots of the chiropractors and chiropractic students weren't able to help me with. I went to an applied kinesiologist, somebody who used the human body as a diagnostic tool using muscle strengths and weaknesses, and they found what was wrong with me, and within a week I was better. So I was hooked, and I became an applied kinesiologist. In my practice, through applied kinesiology, the pelvis has been my major thrust of focus, no pun intended, of course. The spine and the central nervous system rest on the pelvis. So if I fix a lumbar vertebra or a thoracic or cervical vertebra, if the pelvis isn't fixed, the foundation of that person's house is not in order, and that problem's probably going to come back. Then after working with the pelvis and learning that through a great couple of mentors, I had some very chronic issues with my feet and neuromas and knee problems and hip problems from a long-term career as a gymnast. And someone said, "Oh, I think it's coming from your feet." That was another kinesiologist. So we put some orthotics under my feet, and it magically, within several weeks, got rid of many of my conditions. And I realized that my chronic pelvic misalignment was actually due to chronic foot misalignments just from chronic abuse. So that set me on that path to start learning as much as I could about feet and knees and hips and orthotics. And that served me very well because that turned out to be my second foundation that I use in my office. Now, I've been doing that for about 27 years, making orthotics. Several years ago, I was turned on to 3D imaging. And Comfort Fit Labs, who is the company that I chose to work with, has just chosen me recently to be one of their spokespeople. So we are actually in the process of setting up and making videos for other chiropractors around the country to start utilizing this system. So after doing that for many, many, many years, now that I'm going to be 54 this year, several years ago, the cardiologist who was practicing next door to me said, "You know, the hospital's opening up a new wing. Let's go. Let's move in." And I said, "Chiropractor, hospital, doesn't go so easily." He said, "We have nothing to lose." So I thought I'd try to be a pioneer for the chiropractic profession, not a whole lot of chiropractors in hospitals. I put in my application, and it took actually about a year or so before they got back to me and said that they were going to allow me to grace them with my presence. So I joined Putnam Hospital Center in Carmel, New York, and I started there in March of 2010. And trying not to disturb too many people, cakewalk this chiropractic stuff into the hospital, forge relationships with doctors one by one, trying to convince them that I wasn't such a terrible guy. And then August, I put my lips to this product, ASEA, for the first time, and realized after my wife's condition is significantly helped, and mine are, and virtually every one of the first half a dozen people or so that I used this product with had remarkable results, that I really needed to bring this product into the hospital. Now, I just spent 27 years building a reputation to try to get into this hospital, and now 6 months later, I'm going to be the guy to bring in this product into a hospital and convince all the doctors that it's going to change their lives. So that was probably just, I guess, a bit of insanity, but we did it anyway. So we are now double pioneers. And after realizing exactly what ASEA does for people, I realized that that's my third foundation in my practice. So it's first the pelvis, and then it's the feet, and now to have a cellular foundation, ASEA helps everything get better. It is amazing. Of course, we are merely replenishing that which is already there. We just don't have enough of it, or the balance just isn't great. And of course, I have this tightrope that I walk, because in my office, I diagnose and I treat, and then the body cures it. And then with this product, I can't do that. So I cannot claim, I cannot diagnose, so it's a tightrope. So I try to be very compliantly non-compliant. Once we started seeing things in the hospital with my patients, and I now have a couple of hundred people on this product, it became very evident that this has to get in the hands of everyone, and that it's okay to be a pioneer as long as you're backed by science and truth. So it's now starting to branch through my hospital. So the first medical doctor that I put on it after 3 weeks said it didn't help him, even though my patients were having miraculous, remarkable results from the product. They go in and say, you know what happened? I think it's from this stuff. And he would say, nah, it can't be from that. It doesn't do anything. And then when I saw him in the hall a couple of months later, he said, you know that stuff? I think it actually helped me. And I said, have you been lying to my patients for months? He said, when I think back, I really did feel very good on that product. I think it's helpful. Could I get more? Tomorrow, the medical doctor who is now doing this in the hospital with my wife and I, we are doing the first vendor presentation of ASEA in Putnam Hospital Center in Carmel, New York. So we have 3 hours to sit outside the cafeteria and spread the word as pioneers, and we are going to teach the doctors and the nurses and other healthcare practitioners that are in this hospital what it is this product does. And we are first probably going to be met with doubt, and then at some point some violent opposition, which we've already felt. But ultimately the goal is to get to self-evident acceptance, and we are going to go from there. As far as the results that are going on, actually, the results are now starting to spread across the hallway, the doctor across the hallway from me. And he became a patient, and he really enjoyed his chiropractic, but he wasn't really sure about this product, but he trusted me. And his condition was that he was having difficulty sleeping, and by his age and by his overall health, just by seeing what happens with people, now that I've gotten to see hundreds of people, I knew that in his age group and that he was in pretty good health, that probably within a week or so he was going to start sleeping better. Just because his oxidative stress level was decreased, because his cellular foundation was improving. And I said, I think that's going to be helped in about 8 days. It's really possible. And he said, no, that stuff can't possibly work. It's salt water. And I said, no, you're trusting me to work with your body. Trust me. I think within 8 days we can get a change. So on the 5th day he came in and said, that stuff's crud. And I said, no, it's not. Go back to your little office across the hall. I said, 8 days, it's only 5. So after 3 more days, he came back in and said, okay, that stuff's a placebo. I said, why? Did that problem improve? He said, it did, so that stuff's obviously a placebo. And I told him, a placebo is when you think it's going to work. You said it was crud. And of course he used New York profanity. So he said, okay, I have some people I want to try this with, and now it's been spreading. I got a call from one of our mutual patients crying and thanking me last night. She had the same condition that my wife suffered from, that she reported similar results, that her condition was improved because we improved her cellular foundation. My wife had a tick-borne illness that she had suffered 6 years prior, and it became very chronic, and then morphed into a different condition that caused her to have severe exhaustion and fatigue with generalized musculoskeletal complaints. Every muscle and every joint took turns hurting. She needed the help of a rheumatologist. She was on Lyrica and Cymbalta and other medications that helped her with her energy. Within 3 days, her symptoms were markedly reduced. So from there, other doctors are now starting to talk about it. When we present them with MRI reports and CT scans and PET scans and blood work, they can't ignore it. One of the doctors, who's actually the partner with the doctor across the hallway, who's not so convinced yet, when I had a blood work change that was dramatic, that a person had been trying to change for 30 years, and we sent it in to him to look at, he looked at the results, black and white, and just said, nope. And his partner said, what do you mean nope? And he said, no way. Put it down, and he walked away. So he came and he told me, and of course I love challenging people, sometimes as a full-fledged pioneer, and I went in and I said, I heard you said no way. I said, do you think in the spare time that I don't have, I'm actually making up blood work? So he's in the violin opposition phase, and hopefully very soon, once he sees more of this, like the other doctors in the hospital, he will see that this is self-evident acceptance, and we will move forward, hopefully, into this new frontier of medical doctors. When I spoke to Dr. Gary Samuelson in Orlando, he had a great thought. Excuse me. He said that, these doctors that are in the hospital that don't want to hear from the chiropractor peddling salt water, he said, where do they learn most of their information about new drugs? Excuse me. He said that they learn it from these pharmaceutical reps who come in, hand them studies, and tell them what the physicist taught them at their drug company. He said medical doctors are not doing this research. They're not being told by medical doctors what to do with their medications. The physicists, like Dr. Gary Samuelson, they figure this stuff out for the pharmaceutical companies, and then they train the pharmaceutical reps to go train the medical doctors who then suggest to them that they use these medications. Dr. Gary Samuelson said this is one of the greatest scientific and/or medical breakthroughs of our generation. And I said, so how much of that line is actually hype and rhetoric? And he was not offended, but he was a little surprised, and he said, oh, no, you don't understand. He said, as this goes on, he said, you will see that there is no question that this is one of the greatest scientific and medical breakthroughs of our lifetime. That guy knows what he's talking about, and I am perfectly happy to hitch our pioneering cart to Dr. Gary Samuelson and to this amazing breakthrough product. See ya.